Good evening, everyone. My name is Hiba Fathi. I'm senior specialist in Ebdicina Hospital. My specialty is neuro. Today, it will be small workshop about some outcome measures, inshallah, for tomorrow, inshallah, for our Day for Parkinson. And thanks for all your participation and your cooperation with us. And I wish, inshallah, it will be a good day for the patient benefit. So in the awareness day, we will do 5 tests. Okay. First one, we choose from different positions, 1 test. Okay. So for example, set to stand, we choose the 5 times set to stand test. The purpose of this test to measure the functional lower limb muscle strength and evaluate the transitional movement and the balance, and with the which is a lag point for Parkinson. So we just need a chair, and the patient will sit, folded his arm in front of his chest. Okay, foot supported on the ground. Okay, we will ask the patient to stand up 5 times, and 5 times without stopping in between as much as he can. Okay. And we'll start to measure the timing 5 times once the patient starts to stand, and the last timing will be when the patient achieves the standing position of the 5th repetition. So by this, we will count the timing of 5 times set to stand. So the normal score value, because we are dealing with old age Parkinson patients, so from 60 to 80, the normal for them, it's 11 to 12 seconds. Okay, so for any other age below the 60, it will be like 9 to 10 seconds. So only for our Parkinson patient or old age will be 11 to 12 seconds. So more than this is considered that patient has risk of fall and also bradykinesia, slowness of the movement. More than 15 seconds means this patient has recurrent of fall. Okay. Second test, we choose the gait, so which is very important for the Parkinson patients. So we choose time up and go test, tug. And as I think most of us know, the purpose of this to measure the functional in relation to balance, and to measure the progress of balance from sit to stand, then walk, then turn, and again sit on the chair. Okay, and of course, it determines the fall risk. So begin by having the patient sit with back supported, okay, on a standard armchair, and identify the line or the distance 3 meters on the floor. And then we will ask the patient just to sit with back support on the chair and start to move once the therapist will tell start, go. So we'll give some instruction for the patient that once we tell go, you should stand up from the chair, walk to the line or to the mark on the floor, at the floor, which is 3 meters, then turn around the mark, then walk back to the chair with your normal place, and sit down again with back supported. Okay, so we will calculate the time once the patient start to move. Okay, from sit to stand, and then go, turn, and again walk, and then again sit with back supported. Okay, normal timing for all the patient is 10 seconds or less, maybe 7 more, but for Parkinson, old age will 10 seconds, it will be accepted for them, but more than 12 seconds considered to be risk of fall. Okay, more time means more risk of fall and recurrent fall. In this test, the patient can use his own aids like walker, like cane, okay, but it shouldn't be with physical assistance. We're not giving the patient any physical assistance. So it's very important. Inshallah, tomorrow you will see our Parkinson patient, and you see most of the patient has a problem to start to change the position from sit to stand or turn, and again sitting back to the chair. So please, we should be careful and encourage our patient to do this test as much as they can in speed. Okay. We have other 2 test, which is not similar, but it's depending on the time and the hand function and the coordination of bilateral upper limb. One test called box and block test, and the other test called 9-hole leg test. The purpose of both of them is assessing upper extremity function and unilateral growth, okay, with individual with Parkinson and the coordination. So it's very important for this to test, so any patient can do, and they will have fun while doing, and encourage them to do faster. So for example, we'll start first with 9-hole big test. We just had like this, what you see here, okay, this device we have inshallah tomorrow with 9 holes with 9 pins. So we'll ask the patient simply to take the pigs from the container by one hand and put it into the holes, okay, on the board as quickly as he can. Then we will ask the patient again to remove the pins again and put in the container here, okay. So just take from the container, put in the hole, take off from the hole to put again to the container, and we count the time, okay. And there is no time for this patient or cutoff score for this patient. Every patient according to his speed and his coordination of upper limb, so we can compare between the right and the left. It will be nice, okay. And we can even give them some instruction to do at home with simple equipment, so it will be in the same time as exercise. By the way, all the tests, it can be as exercise. We give instruction to the patient to do, and it's good to give him a time or a number so he can be encouraged to motivate him and to do more our best number. Like I told, the score based on the time taken to complete the test activity. So it's recorded in seconds, and we do for both upper limb like I did. Of course, stopwatch should be started from the moment the participant touched the first pick until the moment of the last hit the container, okay, whatever, putting in the container and putting in the hole. The other one is box and block test. Like this you see here, okay, it's 2 boxes. This box, it should contain like 150 block, okay, and we need the patient to take the block as much as he can, fast, of course, quickly, from one box to another, okay. But 150 block is too much, so it will take more time, and we will be in our awareness day, so we just make it like 30 block only, okay. It's enough for the patient and fast. The 150 block, it should be in 60 seconds. So in 60 seconds, you will count how much the blocks, the patient start to move the blocks from container to other. But because it's not 150, so we will choose only 30 block, it will be only in 12 seconds. So you will count in 12 seconds how much the patient moves the block, how many the patient move the block, okay? And we can compare the right and the left. So remember again, it's only 30 block, okay, 30 cubes, okay, in 12 seconds. So, and the patient, there is some tricks in this, okay? If you pick, you ask the patient, if you pick 2 on the time, it calculated at 1, okay? Some patient will be in hurry and take 2 cubes. No, please, only 1 on the time. And if he took 2, it's considered as 1. If he dropped 1, he took the block, the cube, okay, and passed the separator, okay, and it fell the ground, it will be counted as 1, okay. So this box and block test. The last one, which is the easier one, spiral test. Spiral test is some of art tests or writing tests, which is very important. You will have like this paper. Actually, spiral test should be digital on computer with a pen, but we simplify this for the patients. So only we have a printed, you will have like printed paper like this with the spiral test. The spiral test the motor dysfunction in Parkinson disease, okay, and test the speed of writing and the coordination of upper limb, because most of our Parkinson, the problem is the coordination of upper limb. So the test will detect the sign of Parkinson, and sometimes it's detect the early sign of Parkinson, especially if early aged Parkinson. Okay, so we will have like this drawing spiral, and whether to ask the patient to write on, to track on the line or track between the lines. You can see the tremors and the inconsistency of the movement of the Parkinson. So we will count once the patient starts to draw, whether from inside or outside. It's not a matter. We start the timing, okay? And then we compare between the right and the left. So it's good to give the patient like this, two colors, the red with the right, the blue with the left, and compare the timing and give it home. So it's a very nice exercise and test for Parkinson, especially for the fine motor movement and for the coordination and for eye. Okay, all these tests, I know some of you know the test, some of you it's new for him or for her, so it's easy. Inshallah, we'll send all videos regarding this, all the tests through the WhatsApp group, inshallah, so to be easy, and inshallah will be Ibn Sina staff will be for your support and will cooperate with us. Okay, just to know, just to show you, this is a 9-hole test, this is a container, and this is a 9-hole test. Okay, once the patient, he just will take and put to the hole, and again until, and we will count. Okay, once he finish all, again we'll remove it back, and we will count all the time from the beginning to the end. Okay, the video inshallah will be clear for you, so to understand. Okay, and I think this symbol, this box symbol. So we have all the 950 blocks. Okay, but we use only 30. So the separator here, we will put the separator for the block. Okay, just ask the patient, we will test the right hand, so the block in the side of the right hand, we just ask the patient to take it off. He's not supposed to touch this one, okay? He should cross the separator. So once he will start to hold, you will count the timing. We told only 30, we will not use the 30. So you will calculate in 12 seconds how much cubes or blocks he took, okay? From side to side. So just you will put, and you will counting the time, okay, as much. If the patient hold 2, it's considered as 1. If the patient hold 1 and he across the separator and it's fall down, okay, tell your patient, don't be hurry, don't bother, it calculated as 1, because we want to save the time. Some patient will be careful and they want to take or pick up. No, okay. So it's easy and simple. It will be fine, and we can do the right and the left, and we can again put here. This is the right, the left side. Okay. So this is all about our 5 tests. Inshallah, the videos will be clear more. You can return back and view anytime you want. Okay. Thank you. I finished my my test. Thank you for listening. I wish inshallah I will send now inshallah to the group. Any questions? If anyone wants. Okay. Yeah. Okay. There is two messages. Thank you. Thank you. Thank you so much. And thanks again for your participation and your support. Yeah, Dr. Abir, inshallah, with you. Hello, everyone. Good afternoon. Thank you for being with us. Regarding the event, inshallah, tomorrow, we have to be a little bit early than 4 o'clock to settle everything, and try to be there around 3:30. And inshallah, we will first do like a triage for our patients, for the participants. We will categorize them into 3 categories. We made the special badges, so everyone we have to know. The categories will be dependable on the level of independency and the tendency to fall. So in the triage, we will take care of it. I think you, Dr. Hiba, will do the triage, how to group the patients. We'll decide. Okay, we will decide this later, but the thing is that you have to know we have 3 categories of patients. High risk of fall will be given a code red, and we have, they need assistance, so it's moderately, they are fine. So they will be given like a yellow code, and the green ones, the last ones, will be the fully independent. So they don't need assistance or something. And this is for the sake of giving them the assistance later on, because as you know, as we announced, we will do like competitions. So even to decide which kind of competition we want the patient to go through is through these lines. Each patient will be given like a badge. It will carry the code yellow, red, and green. So it will be easy for you to identify. For us, as will be members of the organizing committee, you will be given a badge of the color blue. So you are an organizer, or from the organizing committee, anybody can ask you a question, or probably if they have any doubts. So you have to know that there are stages of Parkinson, and some of the patients might be on a wheelchair, or they need full support using a cane or something. So that's why we think that we should categorize them first before then deciding which kind of activity. So the day actually after we decided that it will start with the lectures, we will have 1 lecture by 1 neurologist. Of course, the announced neurologist, Dr. Wala Kamel, she apologized. She had a circumstance and she had to travel suddenly. But we have a substitute, Dr. Hussein Haridi, and we also have a video of Dr. Wala. So if we manage to show the video through the assistance of one of the companies, that we will have a big screen showing her video, and then Dr. Hussein also will be there to answer any questions. And then we will have Dr. Hiba Fathi for the physiotherapy role. Each lecture should not exceed 10 to 15 minutes. It will be very brief about the latest treatment methods regarding the Parkinson. We will not waste time on discussing the disease itself. Everybody should be aware of that already. We can give just a brief introductory, but then we want to discuss the treatment. After the 2 lectures, we will start with the group therapy or group session. It also will be led by Dr. Hiba Fathi. She will give you also an idea now about the kind of exercise, because some of you will be needed with the patients, especially those who need full assistance, to guide the patient with the movements and the exercise being given. And at the end, we will have like small competitions, and we will have like 6 different stations for physiotherapy. And each station we will have the test that Dr. Hiba just described. We will do it as a competition between 2 or 3 patients or 4 patients. It depends on the number of participants. Okay, so on each you can also choose which kind of station you would like to help with. Like, would you like to help with the time up and go? Would you like to help with the spiral test? These kind of stuff. So we will give a score, and it will be like a competition between the 2. And of course, all the other specialties will be having booth in the exhibition.
So we will have like OT, we will have speech, we will have pharmacy and nutrition. So also you can guide them where to go. So really, it's a kind of a teamwork. We're going to help each other regarding. So if you don't have any inquiries or questions, all the videos that just been talked about, and this particular video will be shared with you in the WhatsApp, and also we will post it in our hospital Instagram. So, Dr. Hiba, just I would like to have an idea about the exercise, the group session exercises, and which kind of assistance might be needed from you as organizers to help the participants with. Okay? We don't have any questions. We can check, Carlos, and let me know.
No question. Hi again. Okay, as Dr. Abir told, the patient will be categorized according to what assistance he need or she need. Okay, so we need to be careful to avoid any risk of fall with our patients. So according to the number of course, we will need all the participants or all the organizers to be in this time together, okay? And according to the color of the patient, we should be careful, okay, who need assist. So the patient who need assist, we need you to just stand beside in case anything happen, okay? It will be a simple exercise. We'll start like warming up, like breathing exercise, okay? Some stretches exercise for upper limb just to warm up. Then we'll start with ball therapy, okay? We just hold the ball, we'll make a circle, okay, between each patient, like 15, like half meter, okay, for distance to be easy our movement. And the ball, the patient will catch the ball. First, he will throw to himself, catch the throwing and catch the ball for himself, so it's coordination. Second, he will take the ball and just raise over the head, so it will be like big movement through the maximum range of motion, and it will be for stretching, okay? And then he will take the ball to give to other person beside or other patient beside, so it will be like trunk rotation. We'll make clockwise and anti-clockwise, so both direction, and this actually what Parkinson need. Okay, so like I believe in 3-in-1 aim. Okay, so we have coordination, improve coordination, improve balance, improve trunk mobility, improve upper limb, and straight, okay, the postural stability. This one exercise, which is 3-in-1, of course, will take time. Second exercise is stepping exercise. We start by simple stepping, leg by leg, okay, forward, sideways, backward with the right, then step with the left, forward, then we'll make it bigger, step, okay, forward, same direction, and then we'll end with this exercise with LSVT big, some movement. It's a new program. I wish everyone to read and see because it's very important. Okay, so we'll start with some little movement of LSVT big. Inshallah, I can send the video also, correct? So you can know much about the movement. For the patient who on wheelchair, they can do this, okay? But with simple exercise from side to side, we need to encourage them. Inshallah, I will be with you also, guys, to just give them a help. And we will need also like the third exercise, which in mind is a boxing, in non-contacting boxing, because it's very important. Non-contacting boxing, it's like reaching, but with more rotation and through the maximum range of motion. So it improves the mobility and the movement arc for the patient and improve the balance, reaching different directions. So it's very important. So it will help the patient also. And it will go through some more exercise according to the patient, marching in the place if we have a time and we saw the patient not fatigued. Of course, rest in between, inshallah. And we will end with cooling down exercise, some breathing exercise, stretching exercise. So I think this much exercises is enough for our patient, and they will feel enjoy when they are doing, and I wish, inshallah, all of us to cooperate with each other, and we will help our patients. This much
Okay.
according. Okay, I think it's
Any
good.
questions?
Any questions?
No questions? Everything is clear?
Okay, everything's okay.
خلاص.
Thank you so
Anything,
much.
share it in the group, please, huh?
Yeah.
WhatsApp group. Thank you so much.
Yeah, thank you, Dr. Abir. Thank you so much. Thank you again for your participation. Thank you. Thank you. Okay. أنا دزيت دكتور